2020 was a very unusual year for emergency medical services. We had all the usual tasks, and then came coronavirus. COVID-19 changed everything. We had to protect you as citizens, and we have to protect EMS to help you. EMS have been exposed to COVID-19 and has helped you without hesitation. EMS have been front heroes in healthcare and still is. EMS are involved in testing and in vaccination in our community. Many people have realized how important EMS is to our community. I'm proud of what EMS in Europe has accomplished. Our staff in the call centers, in the ambulance services and in testing facilities are the real heroes. We look forward to a future with more EMS and less COVID disease. And in Danish, pas på dig selv og på andre, sammen kommer vi igennem krisen. Tak.
Hello, I'm Fiona Moore from South East Coast Ambulance Service in England. I'd like to tell you a little bit about the impact of the new variant of COVID-19 in England. So in November, we saw the impact of the Kent variant. Our hospitals quickly became overstretched, and we in pre-hospital care worked tirelessly to support them and to ensure that we had maintained critical care availability. The Christmas period and the New Year was especially challenging. However, over the last 2 weeks, we've seen cases fall quite dramatically. Over the last week, cases in England have reduced by 25%, but we are still seeing deaths in hospital. Last week, that was running at over 6,000. Vaccination story's been really positive. We've seen over 8 million people have their first dose of the vaccine in England and almost 500,000 their second dose. And we in South East Coast Ambulance Service have vaccinated over 70% of our staff. So my message to all of you is take care of yourself and others. Together we will overcome this crisis. Thank you.
Greetings from sunny Scotland. My name's Jim Ward, I'm Medical Director of the Scottish Ambulance Service. I'm here just to say a word of thanks to all those working in ambulance services and EMS across the UK and Europe for the incredible work they've done in support of our people affected by the COVID-19 pandemic. The effort, commitment, delivery of imaginative and innovative solutions, and the sheer willingness to work day in, day out in support of our communities has been incredible to witness. I'd just like to say how proud I am to work for the ambulance service in Scotland and to work with my colleagues across Europe. Look after yourself, look after each other. We will get through this. Thank you.
It has been a very difficult year. Long shifts in PPE, caring for very sick patients, and worrying about whether we or our family members will contract COVID. Outside of work, we haven't been able to see as much of family or friends as we would have liked, and we haven't been able to enjoy the activities that we love. One of the reasons so many of us work in EMS is the resilience, the optimism, and the can-do attitude that we all share. These are the qualities that will get us through this. There will be an end to COVID. There are better days ahead. Take care of yourself and others. Together, we will overcome this crisis.
My name is Stefan Polocek, EMS Medical Director of the city of Berlin. For 1 year now, EMS staff has been fighting the coronavirus. During this time, we recognized the importance of a strong community-based healthcare system. EMS is the dedicated emergency part of it. And we learned again that the most important resource is trained staff. We may be able to organize ventilators or field hospitals, but it's impossible to add paramedics and nurses to our system within a few weeks. I want to thank all of our staff for working all this time with PPE, still being in the risk of infection, despite them seeing patients suffering from COVID-19 and the consequences of isolation, despite having to take care of their own loved ones, especially their children, and still trying to be a perfect paramedic, call taker or financing manager in EMS. Liebe Kolleginnen und Kollegen, passt auf andere, aber vor allem auf euch selbst auf. Gemeinsam werden wir die Krise bewältigen.
Dear colleagues of the EMS community in Europe, My name is Martin Smeekes. I'm from EMS, the Netherlands, in Alkmaar. In the Netherlands, we've been coping with COVID-19 for almost a year now. We had a strong wave in spring, we had a second wave after the summer, and now we're preparing for the third wave, which will be caused by the variant of concern. And it has been very hard work for EMS, both for our workers in the control rooms, our intakers and our dispatchers, and for our ambulance workers in the region, doing many shifts and working very hard. And I'm proud that in cooperation with our colleagues in hospital, in the elderly homes and the general practitioners, we worked as one entity and working closely together to cope with what was coming to us. In the same period, we've been exchanging, as leaders from the EMS Leadership Network, we have been exchanging best practices to learn from each other. And I'm really happy that with the third wave coming, we had the possibility to protect our 6,000 EMS workers in the Netherlands with the vaccine of BioNTech Pfizer. And now I'll switch to Dutch. Pas op jezelf, pas op elkaar en samen zullen we deze crisis doorstaan. Heel erg bedankt.
After Christmas, the third wave has been established in Spain. A third wave that is exceeding the rate of infection and hospitalization of the second wave, with incident figures close to 1,000 infections per million inhabitants and approaching the numbers of March. Hospital occupancy rates due to COVID exceed 25% of all beds, but perhaps the most worrying data is that intensive care units are close to 50%. On the other hand, vaccination is not going at the expected rate and is around 2.5% of the population due to the situation of pharmaceutical companies. Different measures has been taken in each Spanish region, some stricter than others, but it cannot be said for sure which measure has been more effective. But I think we are in a phase in which the decline in infection will begin, which will have a slow pace. Por favor, cuídese y cuide a los demás. Vamos a superar esta crisis todos juntos.
Since the beginning of the crisis, the French EMS system, SAMU, has been on the front line. We have received a lot of calls. We have tried to keep the patient at home when it was a non-severe case. We have also transported thousands of patients, admitted them directly to intensive care unit when it was needed. We have also organized inter-hospital transport from the region over Elm to the others where there was room availability in critical care units. We have done that by helicopters, by train, and all the means needed to transport them. We have still a lot of patients. The new strain from UK is developing in France. We have a lot of patients hospitalized in critical care units. But we are fighting, and our team are ready to face this new phase of the pandemic. Maintenant, prenez soin de vous et prenez soin des vôtres. Ensemble, nous allons vaincre cette épidémie.
Good day from Helsinki area EMS. Finland has been one of the least affected countries in Europe during the COVID-19 pandemic. At the moment we have 140 patients in hospital care and of those 25 receiving intensive care. The infection rate of EMS staff has been extremely low. Almost all of our staff have received the vaccine, but unfortunately at the population level the vaccination rate is still very low. EMS has been contributing a lot to the diagnostics and care of COVID-19 patients and by data to get a national situation awareness. Pitäkää huolta itsestänne ja toisistanne, vain siten voimme selvitä tästä kriisistä.